My name is Sam Yoakum. I'm a non-operative spine specialist. One of the many things that can cause back pain is called leaky disc syndrome. The discs themselves actually can start to fragment at the edges, and the material from the inside of the disc can leak its way out and create inflammation, sometimes inflammation of nerves, sometimes just generalized back pain. The goal of Discseel is to seal those discs up so they don't keep causing that inflammation. And as that inflammation dissipates and your body calms it down and it goes back to normal, you get to go back to normal. To find out if you're a good candidate for Discseel, we'll need to have a conversation. We'll need to talk about what you tried, what hasn't worked before, what your symptoms are like. We'll need to look at your MRIs. We'll get an opportunity to evaluate those things, and when we see you in the office, we can examine you and determine whether this is the right procedure for you. Once we perform an annulogram, which is a small dive procedure at each disc level to see if there are small tears in those discs. If there are, we'll go ahead and seal the disc itself with fibrin. Fibrin is naturally occurring. We actually see this in front of us. Anytime you've had a significant scrape and developed a scab, the scaffolding that lets those cells build back together across that is predominantly made up of fibrin. It tightens over time, it allows space for cells to grow across that area, and that's exactly what we want it to do inside the discs. We want it to fill those small tears, tighten that material, and preferably allow for scaffolding of cells to grow across there. My hope for patients with the Discseel procedure is that we can get away from chronic pain lifestyle and back to your normal lifestyle. We want you to be active. We want you to be able to do the things you want to do. Enjoy time with your family, with your friends, out in nature, playing sports. That's the whole goal, is to get you back to normal. So if you think that Discseel might be right for you, reach out to us. My team will contact you. We'll start your evaluation. Let's get started.